Welcome everyone to Growing with Health Workforce Queensland webinar. I'm Sandra from Health Workforce Solutions team. I'm the team leader here with Health Workforce Queensland. We have students from Grow North Queensland and Grow Southwest Queensland here with us today, and we are really looking forward to having a discussion with you all this afternoon. We hope that you get a lot out of this session. Before we begin, I would like to acknowledge the country, and I would like to begin by acknowledging the First Nations people as the traditional custodians of the lands on which we are meeting today. I'm hosting this meeting from the lands of Turrbal and Yagara peoples, and acknowledge the traditional custodians of the various lands on which you study, work and live today. I would also like to pay my respects to elders, past, present and emerging, and extend that respect to all First Nations people present at today's session. A bit about us and the flow of the sessions today. So we are a not-for-profit rural workforce agency funded by the Department of Health, focused on making sure remote, rural and Aboriginal and Torres Strait Islander people have access to skilled health professionals when and where they need them. It's important to note for this session that the key element of our funding is to place health professionals in primary healthcare roles in rural Queensland. We will be talking to you about how our future workforce and health workforce solutions teams can support you on your journey from being a student all the way to finding a job as a new grad, which will be supported through our Health Workforce Solutions team, about a financial support available to you with relocation incentive packages and the ongoing support and career progression opportunities. So they will be part of the session. We will also have 3 guest speakers joining us today. They are all allied health professionals who will be talking to you about their journey into rural health careers. So welcome once again. I will hand it over to Meredith Connor now. She will be talking to you about Pathway to Rural Health Employment.
Thanks, Sandra, and welcome everyone, and welcome to the Grow students from Southwest Queensland and North Queensland. This is your first opportunity to actually meet each other. You all know me, I'm Meredith, I'm the Future Workforce Team Leader. I just want to speak to the slide. If we could just go back one slide, please, to the, this is really a visual representation of your journey with us and with each other. When you first came onto the program in your first year, we've conceptualized you as growing seeds that came together, and really the first part of the program was that rural immersion experience, which continues for years 1, 2 and 3. And then as you move through your academic years, we're looking to grow those connections, not only through the rural immersion events, through your billeting and your community activities and the clinical skill sessions and the relationships that you form with the local health professionals. The next part of your journey is then to go return to those, to your Grow communities, and there to undertake your university placements. And that's certainly started, that part of the journey has started in North Queensland and will continue next year. The North Queensland students are a year ahead of the Southwest cohort. And so once those placements and those connections are strengthened, we're then looking towards you returning to those communities as early career graduates, and that's where you're represented in that blue section, where you start to grow roots in the actual communities by, as I said, taking up employment and working alongside you all the way throughout the journey, right from year 1 right through to when you you become an early career graduate, is the Health Workforce Solutions team, and also our Health Workforce Connectors. You've met Ash in North Queensland, and we're just about to recruit a Health Workforce Connector to the Southwest cohort. So that's just a little bit of an overview of your journey with us as Grow Rural students.
Okay, well, it's over to me now. Hi, I'm Louise. I'm from Health Workforce Queensland, and I'm the regional coordinator for Western Queensland. So I'm going to be just doing a quick introduction to Eliza Wallace and to Lauren. And we basically are going to be talking about why live in rural and remote Queensland. And you've already got a feel for it for going on the Grow um, the times that you've gone on Grow already, but we just want to actually go through that a little bit more in detail and actually talk to them about their experiences as a new graduate going into the workforce. Eliza, do you want to introduce yourself first off?
Hi everyone, my name's Eliza. I am an occupational therapist working here at Vital Health Roma in Southwest Queensland. And I have been working within this role for 18 months. So I started as a new grad in January 2023.
And Eliza, what made you to actually decide to take on a job in rural and remote Queensland in Roma?
I grew up in a rural town myself. I grew up in a little town called Mundubra, and it only has about 2,000 people. So I moved to Brisbane for uni, and that was really enjoyable, and I did love it. But I always knew that a rural lifestyle is what I always wanted. I really craved the people aspect of my profession, and I think that you can get a very detailed and valued relationship with people out here. People really appreciate your presence within the community, and you can really establish a lovely relationship with your clients.
With when you actually were moving and deciding to go, what were some of the factors that helped you to make that decision to move?
Yeah, in terms of a career decision, I wanted to make sure that I was going to a workplace that had adequate supervision and support. So I ensured that I was going to get weekly supervision from a clinical perspective, as well as the administrative side of things as well. And I think feeling supported within that move was really important to me. So I was actually able to access the Health Workforce Queensland relocation allowance, which was really beneficial because I ended up moving 600 kilometres away. So it's a big move. It's not as if you can just go back and forth and pick up some stuff from your house. So that relocation allowance was really beneficial and positive for me, and really assisted with that move.
And how have you assimilated into the community now that you're in Roma?
Yeah, I've really enjoyed settling into the community here in Roma. I also service several other communities within our region. I do outreach trips within the region as well. But I found it really quite easy to settle into the Roma community because there's so many social events, and Vital Health were really accommodating for all of the new starters too. So they ensured that we had enough, social engagements and things like that, and opportunities to meet new people. So yeah, I found it relatively easy to settle into the community, and everyone was certainly very welcoming, and they always appreciate seeing a fresh face in a rural community for sure.
Laura, I'm going to throw it over to you now. So Laura, you're working in Cairns as a physiotherapist.
So I moved up on the 1st of January. My APRA registration got held up by a couple of weeks, so I actually couldn't start working until the 19th. So I just last Friday passed my 6 months probation, and I'm officially a full-time employee.
Excellent, congratulations. And how have you found the experience of moving to Cairns, and how the community accepting you, and how is it working in a new environment? Because I know you were working elsewhere before then.
It's a big change. So I come from a town with 30 people in it, and Cairns is a huge city to me, and I have had all these patients very excitedly welcoming me to their little town, and I'm going, this is not little, this is a city. I actually, when I was applying for jobs, so I applied for a lot of jobs through Health Workforce Queensland, the online portal. I got offered my dream job, but it had absolutely no new graduate support. So I actually made the decision to go with a job that was less of the rural outreach, but had more of that early career. I'm in a really good learning environment, and the job is actually this week. They've decided that I can start doing some rural outreach if I can find GP clinics that would like to have a physio for a day. So I'm really enjoying that aspect of it. The work is amazing. I love having an income and not being a student with exams. That's a very good side of being a new graduate. I can actually do some work and feel good about myself and then leave it at home. So I get to have that work-life separation, whereas uni is all stress.
And Laura, it's Meredith. I think it would be really great for the students to hear about your journey with Grow Rural because, but I'll let you tell that story.
Yeah, so I was actually a Grow Rural student in the first ever cohort, so 2017 to 2019 in Central Queensland. I joined up in my second year when I was at JCU and then did the program, had a gap year, changed university, had to redo a couple of years, actually changed to CQ Uni, which was a lot closer to home, so I could study while I was living on the cattle property. Bumped into a couple of other Grow Rural cohorts a year later at a rodeo, and then actually at the start of this year met the North Queensland cohort when I got to facilitate a physiotherapy shoulder workshop, which was amazing and just felt like a total full circle moment for Health Workforce Queensland.
It certainly was for us as well. It was just fantastic. And it was, I mean, I just want to say, you know, Laura, you've always been such a strong advocate for Grow and, you know, for, I guess, you know, your journey in terms of persistence and the challenges that you overcome to get where you are today. But in terms of, let's just, you know, step back a bit, you know, it's a huge jump to move from being a student to being an early career graduate. How would you kind of summarize that part of your journey?
It's a really weird feeling. So on one hand, you're going, I'm all grown up now, I can work, I am the expert, I get to fix people. And then you've got the other side where you're going, oh gosh, I am in charge now. I have to fix people. It's this real blend, and you need to try and find the right environment to be in. So where, you know, at uni you're very well looked after and they tell you all these things about finding mentors and early career development, but it doesn't really mean much until you are in interviews for jobs. And one of the questions that your uni tells you to ask is what kind of new graduate support there is. And you'll get some jobs where they have whole programs established with online meetings every week and you've got a dedicated mentor. And then you get other jobs, like I actually got offered my dream job, which I would have been flying 3 times a week out from Weipa down to the southwest corner doing outreach. But the senior physiotherapist was in Townsville and I would be at Mount Isa by myself being the only physio. So it really brings in, you've got to use your critical thinking skills that we develop at university to figure out what's going to be the right move for you. And especially in the long term, if my goal is to be a rural physio, I need to be a good physiotherapist first. And I need to gather all the skills I can early on. So it's a really weird time when you're in that graduating, applying for jobs, moving halfway across the state for new jobs. You've got to make sure that you have considered these things and you're not throwing yourself too much into the deep end as much as we all want to dive straight in.
Eliza, would you say that was, you know, similar to your experience?
Yeah, absolutely. I very much had a similar experience to Laura where I had also obtained a job in a rural area and I was calling up to accept the position and the senior OT accidentally let it slip that I would be the only OT. So they had tried to hide that one from me. So I was in a similar position with as Laura where I really wanted to take the job, but I just knew that it wouldn't be beneficial for my career development. And yes, it's great to have some independence, but that level of independence is not what you need in your first year as an OT or a therapist in general. So yeah, I had to turn that one down as well. I think the main thing I could say is that you absolutely need a job that's going to give you support.
I think Vital Health have been standout and on that level for you.
Yes, yeah, absolutely. They offer a new grad orientation week, so they get everyone together and they have NDIS training, admin training, clinical training, all of that sort of stuff. And we also have a staff house too, which they offer to people who are moving out here for the first time. So yeah, definitely very supportive in amongst the whole transition to employment out here.
And I think there's also a really strong sense of collegiality between you as allied health practitioners. Like I was recently in Roma, and I went to the coffee shop, and I think there were 4 or 5 of you in there, and you're just doing coffee together, obviously really supportive of one another. And I think that's another important part of what you need in a new graduate environment, and often a new community.
Yeah, absolutely, Meredith. I think it's really so incredibly important to get along with the people that you work with, but to also just feel so supported and a member of the team is really crucial. And yeah, being able to do things like go out for lunch or go grab a coffee or things like that is really important. And contributes to that work-life balance too, because you do need a break from the long work days. So it's really important that you have that great relationship with your co-workers too.
So how have you formed those relationships, Eliza, with the team, and have they done different days, or do you go off and do community days? What have Vital Health done to get you assimilated into the community?
Within my first 3 months of employment here, we had a professional development weekend down in St. George. So that was a 3-day weekend where we had different speakers, and then we also had a bit of fun, some fun things like a river cruise and some dinners planned as well. So that was really great to meet everyone that's part of the team, because Vital Health does have locations in a few different areas. We've got clinics sort of all across Queensland. So that was really helpful to meet everyone. And then we always have things like games night or head to trivia at the pub and things like that, which are really important things to do too.
So Laura, what about yourself? How have you connected to the community, and how's it fitting into Cairns from going into a larger area?
Yeah, so my job was amazing. My first weekend up here, I actually got roped into dog sitting for my boss. So that makes you feel very much part of the family very quickly when you're responsible for their fur babies. So that was good. We have events through the year. So at the end of last year, everyone voted on what they wanted to do. Our clinic is part of a larger family of clinics, and what they've done is they've allocated a budget to team building every year. So usually we spend it on birthday cakes, but we all voted this year, instead of buying cakes, we would make a cake in a roster, and we did a cruise around the harbour with unlimited seafood for an hour, which was amazing. We've got our work white party where we play croquet on the lawns coming up in 2 weeks' time. And then in terms of getting part of the community, the clinic, you sort of have those long-term patients who every physio knows, they live there. If you walk too slowly through the waiting room, you will get shanghaied into a conversation and into meeting their grandchildren and their children and their dogs. And so I've very much been adopted, even though Cairns is a larger city. The suburb that I'm in, I've just been fully adopted into that. I cannot walk down the street without seeing one of my patients or someone who knows one of my patients, and oh, you're the new physio, and how are you liking Cairns and everything. But something else that actually pulled me into the community, which classic small town physio things, although it's not so much a small town, but I actually got into a relationship with someone I had met. Initially, he was a patient, and as these things happen, you're a new grad going, I cannot like this person this much. You've got to follow all your rules and registration and not obviously professional at all times, which is challenged a little bit when an extremely handsome young bloke asks the receptionist if he can change physios because he'd quite like to ask his out for dinner. So,
and how's he finding
I've now been pulled into I go to family barbecues every weekend, which I'm learning a lot about Cairns, because locals know which national parks to go to on a full moon, because suddenly you can see the whole bay, which is something I would have known about otherwise. So that's another challenging but good aspect of being the physio in a small area, because you do meet people, you do have to navigate those personal relationships in balance with your professional ones.
Yeah, I'm interested, Eliza, in your response to navigating professional boundaries, how that plays out for you in Roma.
Yeah, it absolutely can be challenging. I had a parent last week ask me if they'll see me at the pub this weekend, and it can be a bit of a fine line to walk. But I think it's important to acknowledge your professional relationship with that person. And yes, it's okay to absolutely say hello to them down the street, chat to them, all of those sorts of things. But there will be people who do try and, I guess, cross that boundary and, invite you in for a coffee at their house or something like that. And so you just do have to explain that there are, I guess, rules and regulations that you do have to follow. And people are very understanding of that, and they completely get it. Clients will try and add you on Facebook or something like that. And again, you just have to explain that that's not appropriate and you really can't be doing that. But no, it's great to have that relationship with people in a small town. And I think they really value your presence within the community, and they like to know that you're a human as well, and you do fun things on the weekend and all of that sort of stuff.
And do you have people asking for clinical advice in the supermarket or at social events?
Yeah, I have had people say that, and I say book in for an appointment, and then I can talk to you about it.
Is that the same for you, Laura?
Oh, yes. And it's actually a funny thing. So my now partner is an ongoing patient, and I will watch him being in pain and be like, can I just poke you? He goes, no, you're not at work. And then conversely, at the IGA the other day, and one of my patients who is a women's pelvic health patient in the middle of the aisle asking me about her continence and different therapeutic devices she should be buying, and could she not just buy the thing at the sex shop? And I'm trying to hush her very, very quickly into how about we discuss this at the clinic in your appointment next week and not traumatize a whole bunch of people in the shopping centre. It's definitely something. And with the Facebook and everything as well, especially you're just chatting, people tell you, oh, there's an event on this weekend, you should go and see it, like a food festival, and you go, oh, great, yeah, sounds perfect. And then you'll get message requests because they're trying to forward you the link, and you're like, oh, this is a very slippery slope, and having to draw those hard and fast. I am friendly. I will be friendly with you. I am still your health professional. And I would love to, if I met you organically in town, then yes, we can have a chat and things, but no, I will not go on a coffee date with you just because.
Yeah.
Okay, well, you might leave that there for the moment, and if you've got any questions, feel free to put them in the chat, because we'll be definitely coming back to Laura. And we've also got another guest speaker coming through a little bit later. So we'll just go and we'll just talk about when's a good time to connect with Health Workforce Solutions and recruitment, and then we'll come back to the guest speakers again.
Thanks, Louise. It's Caro from the Health Workforce Solutions team, and some of you have met me from North Queensland, and I guess this point of the journey is, when is the good time to connect with the Health Workforce Solutions team, as our team is primary focused on finding physicians for new grads within the North Queensland, the Queensland regions. So we've just mentioned, like you're starting to think you might be in your 3rd or 4th year. What do I do? When do I do it? Who should be doing it? So again, we'll be reaching out to you throughout your final years, and obviously when you're away at the weekends with the GROW team. But it's just, don't feel that you're sort of going to jump into the big pool and not know how to swim, because we're here to help that swimming process and finding you the right position as such. So there's just at a point on the slide here that when is it, and that. So again, anytime, come and see us, and we'll can sit down and talk about what your plans are, long-term plans are. So with this one, our services, they're completely free. So you may be contacted by recruitment agencies saying we can find you a job, but in those cases, the practice normally pays a service fee. So our services are completely free because we're funded by the federal government, and we're more interested in the right fit. We'd like to take the time to work with our practices and work with our candidates to ensure that, because it has to be the right fit. It's not necessarily the other opportunities, which are great, obviously, but you spend so much time, and as you've heard from Laura and Eliza, that, you've got to be, your work buddies or your work family become part of your working day, and you've got to be in a healthy and friendly environment, and that's what we try and match you. We can also look at your CV and make some suggestions on how to really sell yourself. And it's kind of a bit daunting when you're sort of looking for something serious when you're at that part of your journey. So again, we can make suggestions on how you can promote yourself, your skills, your achievements through your academic journey, and also what you're looking for in a role, because what suits one person may not necessarily suit another. So again, that's where we like to come in, and we've all got opportunities that we might think you might work with and might suit you. We do have our website, and we list all our current vacancies through a job board. We have a dedicated web page for new grads. So these are practices that we have identified that are interested and have the ability to provide that support and supervision for a new grad. A little bit about our services as well is that if you're looking through our job board and you think, well, I really want to go to this location, again, that's where we can come into it, because even though there may not be a position on the job board that you're looking for, that in that location, because of our strong relationships with our practices, we tend to go out to them and say, hey, we've got this great person really interested in coming to your location. What's the opportunities? And then that's when we work with the practices. So we have a very strong relationship with the rural, regional and remote practices in Queensland as such. And an example of that is some of the North Queensland cohort. We had the opportunity to go to a practice on the Tablelands, and initially when we contacted the practice, they were like, oh, well, no, that sort of thing. But through that journey of building a relationship, we have convinced and they've acknowledged the importance of a new grad and are quite open to taking one on. And having seen how the practice operates, I don't think anyone that actually was part of that session walked away and thought, oh, I couldn't work here. So that is an endearment for the practice. So again, that's the sort of strong relationships that we build with our practices. We know our practices, and there's nothing in it for us, but it's more in it for you. That's why we provide the service and that. So as you can see, Louise has expertly navigated to one of our job vacancies, and you will see that it gives a little bit more information about the location, the services, what they're looking for, and things like that. So again, there's a lot of opportunities out there, guys, when you're actually starting to think about where to. Don't panic, because we're here to help that process through for you.
Hi everyone, welcome. My name's Harleen and I'm the Regional Coordinator for Central Queensland. And as we all speak about different supporting that we can provide you all with, so one of the support that we can provide you all with is the incentive funding packages that we have. So it's for the successful candidates who are actually relocating to rural and remote locations in Queensland. Something like we've heard it from Eliza, that how beneficial and how it's impacted her positively when she relocated. So the package can cover the following items, but not limited to. So it's your domestic relocation costs, which could be your flights, returns. Some rental assistance is also there, which can be really great when you're actually moving to a new part of a state, and living costs can be quite high as well. So that can come in very helpful. And then we've also got some car transportation costs covered there for you. Also the incentive funding towards CPD costs, again, some travel and accommodation, towards professional memberships, and also some orientation when you first get introduced to a rural and remote location. So all those things, but like I said, this is examples, but not limited to, for the eligible candidates. And there's also ongoing support that we do provide throughout your career progression. So that comes in scholarships or bursaries, which is available when you provide your services to the Aboriginal Medical Services, primary healthcare service, to community-controlled health services, organizations that are non-government or not-for-profit. And it could be in private space, and anything that you would want to work towards, support is provided.
So yeah, so I think Laura, you've accessed some scholarship funding so far with different courses.
I've got an application in. There is a course I would love to do. So with work, you get a PD budget per year. But when you're a new graduate, there's so much that you can learn, that you want to learn, especially you get to start thinking about where you want your career to go. And if I want to do rural health, I want to be able to provide services that currently aren't existing. So women's health and vestibular with physio is such a big thing. I've already used my PD budget for the year, but lo and behold, I can get access to more PD budget. So I've got an application in. The clinic has a discounted course for 5 or 6 days, I think it is, in New Zealand, that I would really like to be able to go on. So yeah, it just opens up a lot of avenues, especially if a lot of clinics that you work in, if you go into private practice, will have established routines. So for example, my clinic, we have clinical exercise classes. So I had to use some of my PD budget through work to get the qualification to be able to take those Pilates classes. And we are Watson level 1 headache practitioners. So I had to use some of that budget. I haven't been able to do things that I choose to, and I wouldn't be able to do that until next year, except that you've got access to these things. It just opens up a lot more avenues for you.
That's excellent. So that's giving you that extra support there to be able to go off and follow for the client's needs, and upgrade and do that. So that's great. Thank you, Laura.
Yeah, I was just going to mention as well, the funding is $10,000 per year, and it can cover things like conference attendance, accommodation, and flights. So it's quite a big fund for people to want to carry on their PD and also maintain their APRA registration requirements for CPD as well through this funding.
Okay, so I'm just going to quickly touch on so what's next? Like with you're working, you can also consider to become a rural generalist and actually do extra professional development to become a rural generalist. And you can be an allied health, it could be in nursing, it can be in general practitioner. So there's actual organisations out there that can put you on to training to become a rural generalist, and that's a career progression. So you might think, okay, I've been working in my job for the last 2 years. Where do I want to head? Where do I want to go further to become a team leader, to become a director of an organisation? And these are really good pathways to sort of boost your generalist experience. And do you both feel that, Laura and Eliza, that you've got potential to further your career in a community in the rural and remote areas?
Yeah, absolutely. I think rural and remote areas have a demand more than ever for every service under the sun. If you're working in the city, you can go to a specialist clinic and just, for example, in physio, you can just go to a vestibular clinic, whereas out here we have to do everything. So you get to learn so many skills all at once, which is really exciting.
What are some of the barriers that you've come across, and how have you learned from those, have you experienced setbacks, and how you've actually overcome those setbacks?
I had a bumpy start to my year, not because of work, but my car actually got stolen, so I couldn't drive anywhere for 2 months when I first moved up. So, I've gone from being a student to being a new graduate, like paddling like crazy to feel like I'm on top of everything, and then something like that will happen, and just suddenly you can't get groceries anymore. You have to walk to the IGA and you can get 1 bag's worth of things that you can carry in the canned summer heat. So there's definitely a steep learning curve with general life, and then how general life tends to affect work, which is a really interesting thing. And that's, again, if you've got that really supportive work environment, you've got your mentor who, not only are they a clinical mentor and they have a lot of years experience as a physio or as a OT or a speechy, they also have experience of doing life while working. So if you feel comfortable in that environment, those things aren't as bad, and you can manage those sort of hits and do really well out of them. Whereas I would hate to think what would happen if I was in a stressed situation at work. At least you can go to work and you have that safety net, at least. So that was something that I never even considered when I was moving. I just wanted to have a good job and enjoy it, and I never thought about how much that will actually impact every other area of my life as well.
Mm-hmm. That's important to know, isn't it? Okay, so we've got a question from Caitlin.
I was actually a RIPA student I was in the first RIPA cohort as well. So RIPA is a separate program done by these, it was the Southwest Health and Hospital Service. So I did the extended 10-week placement in Roma last year as 2 of my physiotherapy placements. It was a very good program, very well supported, well run. Hopefully they got some benefit out of it. If they're continuing it on, that's exciting to hear. I would definitely recommend going for that one.
Okay, and I see that Annabelle's joined us now. Okay, what made you decide to go to a rural and remote area as a speech pathologist?
I think for me, having grown up in a city, doing university in a city, I just wanted some change. And I had done a few rural placements and just liked the idea of living in a country town. I had no real preference. And then, yeah, I saw that there were positions going in Roma, so I thought I'd give it a crack. And yeah, like nothing really specific made me want to go rural. I think was in my nature to kind of explore new places. And yeah, I'd obviously grown up and done university in Brisbane, so I was just ready to go somewhere else. A bit of change of pace, I think, as well. And the good thing with working rural is I got like a full, very varied caseload. So I think in Brisbane, it was quite not limiting, but it was either kind of mainly pediatrics or mainly adults. And I am mostly pediatrics now, but just get such a wide range of referrals and such a wide range of people, such a wide range of work settings, just a bit of everything, which I think helped coming straight from university.
Who do you go with your outreach services? Do you go on your own or?
Well, so right from the start of working out here, I have been traveling to St. George every fortnight, and that was a pretty steep learning curve. I basically took on a full caseload down there and didn't get a lot of handover, so it was challenging but really awesome like super rewarding. I've had to kind of forge relationships in that town and just kind of, I think people were quite weren't so trusting, because I think in the past there has been a bit of turnover of staff and a bit of unexpected changes and things like that. So I had to work really hard to get stakeholders and clients back on side. So St. George, I'm the only speechy there, but I do have a team there, like allied health assistants, physio, OT, really awesome team. And then I travel to Bandy, which is an hour south of St. George, for day trips, usually every 6 to 8 weeks. And then the other town I service is Surat, which Eliza and I go together.
So what kind of clients are you seeing out there? Is it the Indigenous community? Is it farm? What sort of clients and what sort of presentations is seeing out there?
So in St. George, because I'm the only well, they have speech at the hospital, but I'm pretty sure she's on maternity leave still. So I'm currently really the only private community speechy. Anything and everything, a lot of primary school children, literacy, early language, like kindy kids, late talkers, so little babies. I've got every age. I've got teenagers, people in their 20s. I get a lot of older adults for swallowing support. I've had a few clients with Parkinson's, a few with chronic, like progressive diseases like Huntington's and motor neuron disease. I think those are the ones. Yeah. So just absolutely every area of practice. I've had a few voice clients. Any speech pathology area of practice I can think of, I would have probably seen in St. George, like just such a varied caseload. When I'm there, I work at the Catholic school, homes, clinic. I also work 8 hours a fortnight at the Aboriginal Medical Centre.
How do you find that? Is that I guess that would be very rewarding to see those people in those communities and how they get benefit from having your skills and experience there, and being able to be seen in person within a short time frame rather than having to travel. So you're going to visit them in the location, so that's pretty impressive.
Yeah. I think it kind of also comes back to getting that trust and getting that community education and engagement, because I think we think it's such a great thing, but I think sometimes communities don't recognise their own needs and don't recognise how lucky they are to have a service. So I've been working pretty closely with schools, the Aboriginal health workers, teachers, all sorts of people to try and get people engaged. And I found a really strong approach is just kind of putting yourself out there and like working with the aged care facility and just trying to have more of a presence. And I've found that particularly probably in the last 6 months, I've had a lot more steady referrals and a lot more commitment from people wanting services, realizing that, they have a great opportunity. And I think from our perspective, we value it and we think it's so great and awesome. But I think it takes a bit more work in practice to get everyone on side and get everyone involved. And I think, I really pushed myself last year to forge those relationships. I kind of saw that gap of like, that these people have just kind of been left in the lurch a little bit, haven't really had consistent services for a long time. And so, just trying to create that relationship, I guess, if that makes sense.
Yeah, definitely. And that's what you need to consider, and being able to think outside the box a little bit and connecting communities, connecting to the aunties, the uncles, the elders in the community, and also to the clinics as well. So it's really interesting to know about those barriers, but there is ways that you can actually forge ahead and create those connections and making sure that it's being understood that, you know, people have rotated through so many different health professionals. Yeah, so that's a good thing to talk about.
I mean, I'm from Brisbane and I was just in Brisbane on the weekend. Sometimes I miss it, but a lot of the time it's such a nice slow pace of life. And it just feels simpler. I don't know if that makes sense, but you know, there's one Woolies. It takes 5 minutes to get everywhere. You make friends so quickly, like people are just everywhere wanting to be your friend. Like, I make myself sound crazy popular, but I mean, like, you know, you chat to someone like twice and they'll want to hang out again, and you know, they'll go, let's go to the pub or let's go to this on the weekend. And it's just, I don't know, I found a lot of like just genuine people out here, young professionals out here, which makes it a lot easier to transition.
So I grew up in the country, like town of 30 people, and then moved to the city for uni, moved back out I was out at Roma for 6 months at the end of last year, and now I'm in Cairns. I find the smaller an area is actually the more social you are.
Yeah,
it's very easy in
correct,
cities to sort of get isolated. You've got your group of friends, but because everything's so big and so busy all the time, you sort of, everyone takes it all for granted, whereas you're in a small town, oh, there's a show on, and because we never have other things, everyone will go to these events because that is what's on. Everyone will go to the races, as opposed to in the city there's things happening all the time. You don't end up doing any of them. So I always find smaller towns are a lot more social.
Yeah, I think for me, like, I found it really just fatiguing in Brisbane, like driving all day and like just being stuck in traffic. I think it depends on your personality too, I think. I find I get home and I have more time after work, in a sense that I'm not commuting. I'm not sitting in traffic for my whole afternoon. And something that really used to get to me living in Brisbane was just like, you just finish work at 5 and you'd be stuck in traffic for like 45 minutes home, and then you get home and like here you just get straight home or you go straight to the pub. Like, everyone's very social, so things pop up last minute and it's usually fine because it's 5 minutes across the road to your friend's house, or you know, 5 minutes to the main street. So that's what I found, that travel time not really being there has been really good for me personally.
In 2024, back in the day, if you're in a really rural area, like growing up, thinking when I was like 4 or 5 years old, you don't have access to things because you're in a rural area. You can shop online now. Like, so long as you've got internet, you've still got all your connections to people in the city. You've still got you know, you're not going to miss out on movies because you can access everything online, and the post goes almost everywhere. So there's not the barriers that there used to be.
I think if there's one non-negotiable for your new grad year, it has to be 1 hour minimum of clinical supervision per week. That was my rule, and I think if there's one thing you're looking for in a job, they'll try and throw all the money in the world at you, but I think clinical support is the most important thing. And in terms of managing caseloads, definitely in a rural area, you know, being one of the only private practices out here, we do get a lot of referrals and a lot of people wanting to come in for appointments. I think what's really important and what should be expected of all workplaces is managing that caseload. So for your first initial, maybe, you know, 4 to 6 months or whatever it is, depending on how comfortable you are with your clinical caseload, your supervisors might limit the amount of clients you see. So I think I only saw about 4 clients per day in my first few months, and now I've got the confidence where I'm able to see, you know, 10 to 12 clients per day. But certainly, definitely for a workplace that is very supportive. Yes, you might have a lot of referrals, but the people who aren't urgent can go on the wait list. And your manager should be really well across being able to wait list those patients and make sure that you're managing your caseload appropriately.
Yeah, I agree, definitely. And I think what Eliza was talking about, like, I'm probably the same, you know, And if that's not presented to you on first appearance or, you know, your first orientation, if it's not explicitly stated, I would go in with that expectation of, you know, like, I need clinical support. That's non-negotiable. How can we fit this in? How can we make sure that I'm getting this? Because a lot of the time, you know, our supervisors do get quite busy and we get quite busy. So I think if you just keep those values of, you know, supervision is key, I think it's so easy to get caught up in your caseload. So I think if you just kind of have that in the back of your mind, like, don't let it slip, don't let it, you know, if you miss a few weeks, you know, make sure you make it up. And usually they're pretty understanding about it. Like, I have a few different clinicians that I get supervision from, and they're all pretty understanding and flexible with making times up and things like that.
Something that I really appreciated. So in my interview, I was told I would have extra time with patients. Even now, I still get extra time allotted for initial, so I can get all my paperwork and everything done. And I have, usually we try and get 2 supervision appointments a week, but patients are very good for not turning up for those ones that we've specifically set aside. One of the things that my clinical lead told me, because then we would just spend an hour talking about different cases, if there was anything I was having trouble with. At my first performance review, she said straight up to me that you are not a great physiotherapist, and I am not expecting you to be. It takes years and years to become great at anything. I am only expecting you to be a new graduate physiotherapist, and as far as new graduate physiotherapists go, you are doing really well and exceeding our expectations. And they were really good in laying out, this is our measures that we're marking you on. So your patient retention, how busy you are. They said, these are our numbers that we expect from everyone else. You are a baby. So these are the different numbers that we expect from you. And here is all of these things that you can work on, because we all have those. Here are the different clinicians who are really good at these particular things. So let's set aside some time for you to spend with them. And that was a really good thing to know, even though it's a bit confronting to be told that you're not great at your job. It really takes the load off, that you don't need to put that much pressure on yourself immediately within this first year to be absolutely amazing at your job, and that no one is expecting that of you either. They said that your patients are going to love you regardless, because you're going to help them. You've done university. You know everything you need to know to help them. You will be able to help them better in a few years' time. And in 10 years' time, you might look back and go, oh, I should have managed that case completely differently. But that's what we expect. That's what's normal. You have only been doing the job for a short amount of time. And I think that that's a really important thing to keep in mind, because I was putting a lot of pressure on myself, and it's a very common thing new grads do. And it's good to know that no one's expecting you to be a 30 years experienced therapist in your first year at a university. And if you're in a workplace that understands that and accepts that, which they do when they're hiring new graduates, you're going to be in that position to be a lot better of a clinician, because you don't have that extra layer of stress.
Thanks very much. I'm just mindful of the time, that we ran out of time really, but if there are any questions that we have not answered at the webinar today, we will follow up with an email and respond to those. I will have to close the webinar right now, but I would really like to thank you, Eliza, Annabelle and Laura, our guest speakers. Thank you so much for your contribution and for sharing your journey with us. It's greatly appreciated. And thank you to our Health Workforce Queensland presenters and staff that have contributed to organising this webinar. And a big thank you to our GROW students from North Queensland and Southwest cohorts. Hope this session was beneficial for you all, and feel free to reach out to us anytime if you've got any further questions. We're more than happy to talk to you, to email you back, to help you on your journey. Any questions about the jobs and possibilities and how to format your CV, anything goes. We're happy to support you into your rural health careers. So feel free to reach out, as I said, and thank you very much for everybody's time today.